Dear colleagues, dear friends, welcome again to BG Dental Academy Online. This time we continue our online masterclass series that are dedicated to porcelain veneers, and this time we decided to provide you a really interesting and discussable topic about veneers preparation, different types of veneer preparation when case is coming to molar and premolar teeth. So basically we will be discussing today and showing you step-by-step techniques to prep veneers for molars and for premolars. We are ready to show you three different types of preparations. We'll do type 1, which is window prep. We will do some cusp reduction case, and we will do full occlusal coverage with a veneering of premolar tooth. This is the sequence and this is the program for today. I would like to remind you this is our 5th episode in veneer series. If you didn't see before previous series, you can find records on our webpage en.belgrad.com in webinar or online courses folder, and you may find a lot of useful information that you can implement, that you can use directly after watching of our online webinars. Okay, so just let me make this introduction really short and we will go straight to preparation phases. I wouldn't show you and explain you really deep details regarding technical aspects of preparation. I mean speed modes, different burr sets, etc., because we have a separate online masterclass about this. We will go just straight to preparation for veneers of these molar and premolar teeth. Okay, so let us assume that this is the case when patient comes for aesthetic and functional rehabilitation, and he or she would like to get her or his teeth whiter, and we would like to improve aesthetic outcome of patient's smile. We have to discuss everything with dental technician before we start the case, and because the one who is responsible for color change is our dental technician. Okay, you have to provide to your dental technician enough information to understand initial situation and also what kind of outcome you would like to achieve with your patient as the final result. And your dental technician will guide you regarding the thickness. Okay, he will say that in this case, for example, to change A3 color of patient's teeth to BL color or to A1, let's say, or B1 color, then the dental technician needs, for example, 0.5 millimeters of ceramic veneer to mask this color. Let's just pretend like this. I mean, it's not the certain numbers that I'm just explaining to you. It's just, let's say, average or something that I just imagine. Okay, and in this case, you have to give your dental technician this space. For this, we're using depth cutting burrs, and we always do wax up, we always do mock up, and then we prep teeth through the mock up. That helps us to preserve as much tooth structures as we can, because some parts of preparations will be done within mock up, within plastic, and only some parts, some areas will be exposed in tooth surface, in tooth structures, and we are not preparing tooth 0.5, for example. We prep just 0.3 within mock up and 0.2 in tooth structure, but totally you'll have this 0.5. Okay, in this masterclass we will skip mock up. We will just prep teeth through their own structures here, and I will show you in very precise details all steps of these preparations for all these three teeth. We have already inserted depth cutter. This depth cutter that I'm using is from our burr set, and exactly this one that we are using is, let me just give you a reference number of this burr, this one that has depth of 0.4. This is the depth here, the ledge here is 0.4. This is the number of the burr, so this is 0.4. And the good thing is also for this burr is the tip here is 1.5 millimeters. This tip can be utilized as depth cutter for occlusal, for example, surface. Okay, so I'm going to stage 1 of preparation. Stage 1 of preparation is when you are using high speed. You can use turbine, you can use electric, an increasing handpiece with a high speed with a lot of water, and all of your preps have to be done supra-gingival. All finish lines, considering their position in relationship with gum, will be given into the stage 2, and we will display you, and then we will explain you in details. Okay, so let me just start preparing. I'm using my depth cutter. I'm using that depth cutter for buccal surface. You see that the tooth is pretty short, so I cannot use these 3 active elements. Okay, so we can use just 2 of them on molar, on this premolar also. Maybe for this premolar I'll be able to prep for 3 active elements. So let's go. A lot of water. You go within to surface. You see, if you keep correct angle, you will be not able to go deeper. So you go within this surface. The burr has to be driven parallel to surface that you prep. This way you will get equal, or let's say adequate preparation. This premolar will be prepared. This part we will do prep, and also supra, it has to be done supra-gingival. Okay, this is important. What else? The molar tooth will be prepped for window prep. I will explain you why and in which kind of cases, what is the indication. This premolar will be prepped for partial occlusal reduction. This one will be with a full occlusal coverage. So this molar window prep, we will not do anything from occlusal surface. We will just keep these preparations from buccal surface. This premolar, we will do some partial preparation. Basically, we will do butt joint over a buccal cusp, and the technique of preparation for this partial coverage is the same as, for example, we are going to prep canine for classic veneer, when you just make grooves on incisal area and then you join these grooves with another burr. So we are not preparing anything from palatal side. We are not doing any bevel. We are not doing any chamfer or shoulder from palatal or from lingual side. We just do really classic butt joint. So the same will be done here, and it is really important for you to keep your burr straight over the tip of the cusp in order not to get your burr in occlusal surface. Don't go here. Imagine that this premolar is canine. Okay, just I will close a palatal cusp. So this is our canine, and we will prep just over tip of the cusp without inserting of our burr to the occlusal surface. Okay, so this will be done in specific way. Okay, see, I'm just working on the tip of the cusp, and that's it. I'm not prolongating my preparations towards occlusal surface. I'm not going to fissure. I'm not going to the cusp lobe here. Okay. As for this premolar, we will do everything. We are doing preparation over tips of cusps, and also we prep occlusal surface. We prep inside fissure and palatal cusp as well. Okay, so that will be full occlusal coverage. Once you make this type of preparations, you made these grooves, we have to mark everything with pencil or with marker. We have to mark these grooves, these lines. It will be easier for you to determine the depth of preparation. Okay, so we mark all these lines all these grooves, occlusal surface also, so that we will be having less problems in orientation. It will be easier for us to determine amount of our preparation. Okay. We, as I mentioned before, we're using mock-ups for preparation as well. Okay, so what I'm trying to say is that after you mark everything as you see here, I would remove mock-up. I will take some instrument like this one. This is hand scaler, and I will just take out all this mock-up, and I will be able to see where I reach tooth surface. Okay, and after that I will just take my another burr, medium grit or coarse, and I will start to join these grooves. This is the sequence. Considering the fact that we are working without mock-up, I will just continue preparing these teeth. Okay, and I would just prep molar tooth first, and then premolar, and so on. In this case, if your patient can move head more to side this way, or you will also move your microscope, you will have more details for observation. Okay, so that will be easier for you to prep. You can see much more details. It will be more ergonomic for you. So I'm having my depth cutting burr. Sorry, another burr, the tapered one. This one. This is blue stripe burr or the green stripe burr, and we can join now these grooves. For window prep and for partial reduction prep, we keep 3 planes. In keeping 3 planes, we can be really conservative because we will preserve a lot of enamel. Okay, so let me just start my preparation. So here I just go to incisal plane, let's say. Let's assume this is incisal plane, and I would prepare until I need a little bit more water. In a real patient case, we'll use a lot of water during this stage because the speed is pretty high, and I don't want to overheat the tooth. So we prep incisal plane, and see that I'm prolongating my burr to mesial part of the tooth. That will help to mask transition between veneer and the tooth surface. Okay, so this is the angle of incisal plane. We did preparation. Then we keep our burr parallel to the middle plane. Okay, we keep our burr parallel to middle plane until we will lose that mark in cervical area. And also see that I'm making prolongation to mesial part of the tooth. This is important because mesially you can see transition, so you have to be careful in that term. Otherwise, your patient will be not happy with your veneer case. And now, finally, we will move to cervical plane. I will make initial finish line really slightly visible, just a scratch. And the angle that I'm holding my burr is the same as cervical plane. And now take a look what I'm doing. I'm just moving my burr from vertical axis of the tooth, from, and making preparation to distal. Okay, from, like this. Don't do this angle. Don't make this angle. Otherwise, you'll get undercut. So we go, and then we turn. We turn, and we make initial finish line on distal. We have already made initial finish line from buccal, and now we move and turn our burr to mesial aspect of the tooth, making initial finish line here. And we have to move a little bit more to mesial, because we don't want to see transition. We would like to mask transition here. So window prep, first stage of window prep is done. Okay, it's done. Pretty nice. Window prep is, we in some professional communities, we used to say window prep is easy money cases, my friends. I will explain you a little bit later on the indications. So now we go for a partial reduction. Okay, this is premolar, and now we have to cut inside, not the incisal, sorry, the part of tip. And see how I do this? I just angulate my burr same as distal angulation of the cusp. Then I will turn my burr towards mesial aspect of the tip of the cusp, and I'm going from occlusal surface towards buccal. Okay, why I choose that angulation? Because if I will do opposite, for example, from buccal surface to grooves, accidentally I can move my burr to the occlusal surface, and I don't want. Okay, I want to keep my burr straight over tips of the cusps that we have already marked, and we will have butt joint. We would have butt joint. Just also note and notice the angle that I'm using now when I'm preparing occlusal tip of the cusp. I have slight buccal angulation. Don't do this angle. We do this angle, okay? Once we have our cusp prepped, we will continue with planes. Same as we did for molar tooth. This will be incisal plane, let's say. That will be middle plane. And there will be initial finish line and cervical preparation. So you have to keep your burr really parallel to the surface that you prep, because sometimes trying to make finish line, people made this straight angle like you see on the screen, but it will be a mistake, because within a few seconds you will get a hugest undercut in history of dentistry. So you have to keep your burr parallel to cervical area now, okay, not to the long axis of the tooth, but to the cervical area. We are doing initial finish line using less than half of the tip, way more or less, okay, just we're making scratch. Okay, and actually we're done with partial occlusal reduction case. It's a butt joint, and we will go now for first premolar, and you can see that I have prepped all the occlusal surface. I'm changing now the burr. I will use the one that we will utilize for occlusal reduction. This one will be easier to prep, palatal side. And if you want to get all benefits or all possibilities to work with microscope, with direct vision, you can ask now your patient to move chin up. Okay, chin up. You move your microscope forward and tilt your microscope towards yourself. So you will be able to see occlusal surface this way. This position for patient is not dramatic. It is not super comfortable, but it is resistible. If you put some pillow underneath the neck of your patient may stay with this position for a pretty long time. Okay, so don't worry, you will have no problems with your patient position. So I will just take now this burr and start preparing occlusal surface, palatal, all the way until you will lose grooves. Okay, then we will turn our burr towards buccal surface and do the same here. Try to make your preparations and your movements more smooth and continuous. Don't make these rough preparations, just make your movements more smoother. So you will spend less time during second stage of preparation if your preps at this step will be smooth. Okay, so now we have prepped occlusal surface and we're actually ready for buccal surface, and we can finally turn back head of our patient to more ergonomic and comfortable for patient position. But just let me take this corner out. Yeah, now we can change position of head of patient to make it more straight, chin slightly down. Okay, so we will be able to prep buccal surface with this angle. Okay, and the same burr as I used for previous teeth, this tapered, number 16, incisal plane. In this case, when you have prepped occlusal surface, full occlusal surface, the pathway of insertion for restoration will be more vertical, like crown. So in this case we have to prep a buccal surface more like crown. So basically two planes. There will be two plane preparations. So now I will put my burr parallel to bulbosity. The tip of the burr is outside. I'm not doing this angle, just parallel to bulbosity. And I will prep this area until I will remove groove, these marks, and I will be able to see initial finish line. So what is really important during this step is not to make finish line at the very beginning, because if you will concentrate your energy and your attention to finish line, you will make undercut. But we have to concentrate our energy and attention to prep bulbosity, to remove this mark, and you will get finish line automatically because of the design of the burr. Okay, now before the second stage of preparation, let me move my patient this way. Let me dry the tooth surface, and let us finally discuss indications or what kind of clinical cases we will go for certain types of preparation. Now it's more or less understandable and we can discuss. So window prep. Window prep is when you are not preparing occlusal surface. You don't do anything from occlusal surface. You just prep buccal surface, and this type of preparation is indicated when you are just changing color. Okay, that's why we call this like easy money cases. You just need to change the color, and basically these kind of preparations can be done on upper jaw, because when you do lower jaw aesthetic makeover, when patient opens mouth, you can see occlusal surface, and just imagine if you have tooth like A4 color and you are doing BL3 for example, and you will see this occlusal surface which is pretty big contrast. So window prep is more for upper jaw, for molar teeth, for premolar teeth. When you change the color, but you are not doing anything from occlusal perspective. Okay. The second step, the second type of preparation, when we just cut tips of the cusps, and you can see now the sharp ridge here, exactly where occlusal surface begins here. Okay, this is butt area, butt joint area here all the way. It's a platform. So this type of preparation can be done when you need to make tooth longer. So basically you work in aesthetic area, making tooth longer, and also you do some occlusal adjustments. For example, you integrate these premolars into group function. Okay, or when you do lower premolars, and you know that the buccal cusps of lower premolars are more functional, so you can do this type of preparations for some also occlusal rehab cases. And for sure, when you cover all the occlusal surface, these are the cases when you do full molars rehab case. For example, you have attrition, you have erosive, you have tooth wear, you have perfunction, you need to rise the bite, you need to rise VDO, and you need to do something from occlusal area, and also you need to change the color because of the aesthetics. So basically this is veneer overlay preparation. It's not the classic veneer, the veneer overlay preparation, and we can utilize this type of prep in certain clinical cases. Okay, now we're going to have stage 2, and I'm changing the burr for the red one. So previously, I remind you, we are using medium grit burrs and coarse burrs. Now I will have my burr red diamond. The most frequently used one that I work a lot in my veneer cases is this one. You can see that this number, okay, this red diamond. The tip of this burr is 0.6 millimeters. The tip is rounded, so we have to use half or less than half of the tip. But basically, if you will use half of the tip of this burr, you'll have 0.3 finish line, which is good for many dental technicians and for many ceramic restorations. Yes, by the way, I forgot to show you before red burr, before I will start preparing teeth with the red diamond, before second stage of preparation, I would need to control the depth of preparation. Did I prep enough or not enough? So for this, we are using silicone indexes. For posterior teeth, we are using classic silicone index as we use for crowns, for example. This is full coverage silicone index, occlusal, buccal, and lingual, you see. And then we cut silicone index sagittally, so you will be able to see this part of the tooth. So let me put this silicone index to my preparations. Okay, turn head of my patient this way, and we will be able to observe if the space that we create is enough for our dental technician. I would like to remind you that we used depth cutting burr 0.4. So you can take periodontal probe and you can measure. This one is 1 millimeter. You have to take the periodontal probe that is 0.5. I think it's 0. It's halfway, right? 0.5. So basically, we prepped 0.405. It's enough. Let me take depth cutting burr. A silicone index for another tooth, which is upper premolar, the first upper premolar. Okay. Let me check here. The tip of the cusp that we have prepped, and the buccal surface. Okay, that's fine. So basically we are having pretty good preparations, enough space for dental technician. Let me just check also. Let me check just, yeah, this one. Let me check this premolar. to be confident that everything is fine. Okay, the occlusal surface and also buccal surface 0.4, 0.5. So basically stage 1 was provided pretty precisely in terms of depth preparation. That's fine. So what does that mean? And during my second stage of preparation with the red burr, I don't need to increase depth of preparation. I would need just to make my preps more smoother and more precise. Okay, so during second stage of preparation, we will increase magnification. If you work with microscope, you increase magnification. Okay, we put red diamond. We will also decrease speed. The speed will be about 50-60,000 RPM. Okay, I will also decrease water amount. And I would prep finish line. So we have now to understand how far we have to go with the finish line, the cervical finish line. And we have, let's say, 3 scenarios: supragingival, gingival level, and intracervicular. So before the gum, supragingival, we prep in non-aesthetic areas, non-aesthetic zones, palatal side, for example, or posterior teeth, when the smile line is really low and you are not able to see gum area. Gingival level we can use in anterior area, even in aesthetic zone, but if the smile line is pretty low, when patient talks, when patient smiles, when patient laughs, when patient screams, we cannot see gum level. So basically you can keep your preps at the gum level, or if you're not changing the color. And in case when your patient has pretty high smile line and you are changing the color of the teeth, in this case we have to prep to mask the transition from veneer to the tooth surface. So basically we have to prep intracervicular. We put retraction cord, okay? It depends on the type of, it depends on biotype, okay? But almost in all of my cases, in normal periodontium, I'm using the 000 or 00 retraction dry non-impregnated cord, just packing this cord really gently. Sometimes when my preps are really non-aggressive and the retraction cord is packed and preparation is done without anesthesia, you put retraction cord also without anesthesia and patient is okay with that. So you have to pack really gently, okay? And then you move your finish line to the same area, to the same level as retraction cord is, okay? In our case here, I will not use my retraction cord because you see that the gum, the sulcus here is pretty deep. But I will just prep a little bit before the gum just to show you finish lines. Okay, I will just move my finish line a little bit down, more down, but still I will keep it supragingival just for this educational purpose, for you to be able to see what actually I'm doing. Okay, so yes, a high magnification, 50-60,000 RPM, red diamond, burr number 14, tip is 0.6, half of the tip is 0.3, and I will start to make my finish line, to reposition of finish line. Okay, so we move it a little bit more water. During this stage, assistant helps us with air spray. So we move our finish line a little bit down. I'm working with half of the burr. Again, you see what happens here in the distal. I turn my burr, I turn my burr, and you can see how half of the tip is working. Let me take some more water. Okay, that's fine. So we'll do the same from cervical and meso. Turn, don't forget to turn, not this way, to to get your finish line done. One more time, let me just help myself with the air spray because I have some dust on the surface. And also, when your assistant helps you with air, you can visualize better areas that you work with, because with water spray you have highlights and splashes, and it's pretty difficult to understand the depth of your finish line. But when there is air, everything will be easier. Also, once you finish with the finish line, if everything is correct with your finish line, what you can do is just to smooth the buccal surface. Just make it more smooth and no pressure, just gentle movements to get your buccal surface pretty smooth. Okay, so I think that we can say that we finished preparation for molar. I'm not going deeper here on the cervical area, but in the real patient case, depends on the type of smile. I also would go more here just to mask. This is important, by the way, to move more here, because you need to mask that transition, especially in case if your patient has pretty wide smile frame. And just imagine this can be visible and your patient will be unhappy with veneers that are not masking the black or dark color of teeth. Okay, so let me continue with the premolar. Let me just rinse and dry this one. Okay, fine. So we can continue with this premolar, and the same sequence. We just reposition finish line of cervical finish line a little bit more down. Is it in focus? Not really. Yeah. So let's go. Move our finish line more down. Half of the burr or less. This is important, because if you use more than half of the tip, you would make an undercut, and we don't want to make undercut. We will just need to make a really good mini chamfer preparation. From mesial also, just go a little bit deeper to mesial proximal zone to mask transition here. Okay. Make preparation really smooth. Movements have to be smooth. And now just moving your burr really gently over the buccal surface to make it smoother after this medium grid burr. And also this transition, this is the transition from prepped occlusal surface or tip of the cusp towards buccal surface. It has to be really also really smooth, because all sharp internal angles can cause problems for ceramic restorations. Okay, it's done. Premolar is easier because it is more closer to us, and also it is smaller than molar tooth. And now let's go to this one. Same thing, we will move our finish line more down. We move finish line more down, working with a half of the burr, half tip, moving preparations more distal. Pay attention to angle that I'm using now, see? Then we go to mesial. A little bit more deeper mesially because it is high aesthetic area. We don't want to get this transition visible. Okay, now we will make this buccal surface also smooth. We will ask our patient to move chin up. Okay, or we will move our microscope forward also, because that will help us to see occlusal surface. Okay, so now we will just modify that preparation, make it really smooth with the red burr. Same with the buccal aspect. Okay, and see the really sharp transition here is really super sharp. It has to be super smooth, not super sharp. Otherwise, you may expect cracks and problems with ceramic restoration. So that have to be really smooth. Smooth and rounded. This is important. Okay, also what I would like to see is distal and mesial transition joining this outline. This is the outline which is finish line for your dental technician. So we have to join here. Same from mesial. Okay, fine. So basically we finished step 2. Let me dry and see. Step 2 done, and we are ready for step 3, which will be disc, just to make all internal surfaces super smooth and to make our finish line perfect. Okay, so I'm changing my burrs, I'm changing hand pieces actually. We will take our contra angle one, okay, with disc, and we will make all the surfaces really smooth with disc. We put 5000 RPM for disc. I prefer to use Softlex discs by 3M, the orange ones, not the red. The red is coarse one. The second one is orange, I think. So yeah, we decrease magnification just to see this group of teeth, and I will take my disc with just a little bit of water, really little bit of water. We don't need too much. You can even switch off or just have it really little bit, 5000 RPM, and just the abrasive part of the disc is here, is internal, and just moving your disc over the surface, this transition from buccal surface and finish lines. What is important for disc is not to touch finish line. This is important, because if you will touch finish line with disc, there will be no finish line. And you know what I'm really like to work with discs is that disc removes scratches and some small micro grooves from buccal surface, and you can expect a really good surface fit of your ceramic veneer to the surface of the tooth. Okay, this is important. So basically, we are not using discs for polishing. We just make really smooth internal surface. And when you have smooth internal surface, you may get a really good surface fit of ceramic restoration, which is really, really, really important, because you know, in the thin ceramic restorations, in veneers, literally in veneers that are completely reliant on bonding, the surface fit plays more important role than fit to finish line. Okay, so you have to make a really nice internal surface to give your dental technician conditions not to use thick spacer, because if the spacer would be thick, all this space between veneer and between the tooth will be filled with composite resin, which is really thin substrate, very soft substrate, and ceramic being a rigid material, and if it is thin and if it has something soft underneath, it can break. Okay, so that's why internal surface have to be really, really smooth. Same will be with the premolar. Okay, so we move our disc gently over the surface, trying not to touch finish line. And also, you see, with this you can make transition from buccal surface to tip of the cusp that we prepped. We can make it really smooth. Also, if your, for example, if your cusp area is too much wavy or rough, you can make it more straight with disc. Okay, but afterwards you would have to refine the finish line. Okay, but we will do it later on. For this premolar, we will continue having disc with abrasive in front. We will just make smoothening here on the occlusal surface, also on the buccal surface, occlusal surface, buccal side. And that transition, you remember, this transition, as we mentioned before, has to be super smooth, and with disc we can make it happen. It's easier than with burr. Oh, sometimes it happens. Okay, so now let me change the abrasive area of the disc internally, and then we just make some buccal surface smoothening. Again, don't touch finish line, because it will be a problem later on. If you will touch the finish line with disc, there will be no finish line. It will be difficult for dental technician to identify this finish line. But anyways, we have another step of preparation. After you finish with disc, you can go back to your increasing handpiece. Okay, and we will change this red burr number 14 for red burr number 16. Let me show you this one. We'll take this one now. Why do we change it for the bigger size? There are two reasons. The reason number one is if you want to make, for example, finish line thicker, you can do it with a thicker burr. Okay? If you would like to keep your finish line same as it was done previously, basically we make it 0.3, and you would like to keep it 0.3, you can use thicker burr, because sometimes you can get your burr number 14, the previous burr, a little bit deeper than half of the tip, and in this case you may have a small U margin, small lip margin. Okay, and with a thicker burr you can take this lip in a really easy way. Okay, we put speed 2000 on electric motor. With your increasing handpiece it will give you 10,000. So basically now we work with 10,000 RPM, no water, and we will work with pretty high magnification. Okay, working with no water, there is a sort of risk to make some overheating, but with that type of speed, which is 10,000 RPM only, it's not a big problem for pulp. And also what is important, our assistant, Okay, and our assistant helps us with air spray. So assistant works with air spray all the time you prep. But at really low speed, you may feel yourself by tactile sensitivity if your finish line is rough, if your finish line is jumping, your burr is jumping over the finish line. Okay, so that's why we use also this speed, not just not to overheat, but by having also tactile sensitivity. Okay, so let me just modify or improve finish line if it is necessary. See that I'm not working with a half of this burr, so I'm keeping my 0.3 finish line. I'm not trying to make it thicker. Working without water, you can see that you can see details. You can control all these details. And your finish line will be super smooth. Okay, we can make some adjustments here on the top. Also this transition, nice. This is really, really, really nice transition here now. Okay, that's fine. Let's see. Yeah, the window prep done. Now we go for this one. A little bit of water, just make finish line more smooth. If you have any problem, turn, don't forget. Go back to missile, same. And also once you touch your tip of the cast by disc, it's too much soft now. It's too much rounded. This part, I mean, this one. This has to be really sharp. This have to be rounded. This has to be sharp. So let's just refine. I see that I'm also making really visible transition of proximal, from proximal to occlusal. I think that I was not accurate during the preparation of first premolar, so I have some scratch here on my second one, so I can improve this one with this burr easily. Okay, and also that transition has to be fine and visible. So done. I think that we're done. Okay, and now finally first premolar. Same, absolutely everything is the same. The only thing that I would like to pay your attention would be transition from focal surface to occlusal. That transition has to be super visible and fine. Okay, so let me ask my patient to move chin up, because I would go to occlusal and I would like to get this visible, this part. Okay, all this outline is pretty nice, pretty visible. It's sharp enough. It's sharp enough. Okay, here also. Basically, we provided pretty smooth preparation during the previous stages. That's why step number 3 will not take a long, will not take a lot of time. Okay, I think that we also done with that tooth as well. Okay, let me just have this view for you to show all 3 different types of preparations. So step 1 or type 1 window prep. So here is our very final thing. I'm drawing this just for you to show all these outlines, let's say. That will be for dental technician. Here you will have this thing which is sharp. Okay, here. And for this premolar, the first one, this is the finish line for your dental technician. I mean, this outline is the finish line for dental tech. Okay. I think it's pretty visible and also pretty understandable. I hope so. So, during this online masterclass, I showed you 3 different types of veneer preparations for molar and premolar. You can combine these different types of preparation for many clinical cases. You can do window prep on premolar, you can do occlusal reduction and veneer overlay on molar teeth. It's just about certain clinical situation, okay? I would like to remind you also that we still have our stories marathon in Instagram. So just take some nice video shots from this online masterclass and share it in your stories with some sort of creativity. You can type some interesting funny text, and we always repost that creative stories from your side, so many people will see them, your patients will see them, and your patient will understand that you keep on learning, you keep on improving, so you are doing better dentistry for patients, and patients really admire. So always share on your Instagram pages or Facebook pages, in your social media, that you continue your education. It works with your patients, believe me, because we've made a research in that media marketing tools. Okay, so another thing is for people that are watching us now live, we will meet each other in 10 minutes. After the short break, we will do Q&A live session, so you can type your questions and I will reply to them. Okay, for those who are watching us in record, thank you for watching us even in record. I'm really sorry that you are not with us live, because we can communicate, but even though we try from BG Academy side, we try to bring you and to provide you a really nice education, practical tips, practical tricks that you can use directly after our online masterclasses. We call them online masterclasses, we are not calling them webinars. Okay, and I hope you enjoy this live session. I think that I discussed and showed a lot of practical things, so now you will have a certain understanding regarding the type of preparations and techniques of preparation for premolar teeth. If you're interested more in veneer preparations, I would refer you to our webpage ianbelograd.com, where you may find our online educational platform, and you may see our records of previous online masterclasses. For those who would like to get a really next level of education, we invite you to our BG Academy offline, not online, offline, to visit our training center and to upgrade your personal skills in different up-to-date topics. See you in 10 minutes during Q&A. For rest, goodbye, and thank you for being with us.